In today's video, we'll explore two important clinical scenarios. The first involves the acute management of a patient presenting with sudden onset chest pain and respiratory distress. The second case focuses on the diagnosis and appropriate treatment of bacterial throat infection in a child with fever and sore throat. This discussion aims to enhance your clinical reasoning and decision-making skills in these common medical scenarios. A 68-year-old man is brought to the ED with sudden onset right-sided chest pain and severe shortness of breath that began an hour ago while walking. He denies trauma, fever, or cough. He has a history of COPD and smoked for many years. On examination, he is in distress. His blood pressure is 86/50, his heart rate is 120, his respiratory rate is 32, and oxygen saturation is 82% on room air. Breath sounds are absent and percussion is hyperresonant over the right lung. A chest X-ray is obtained as shown below. Which of the following is the most appropriate next step in management? Now the chest X-ray here shows right-sided lucency and leftward mediastinal shift. This patient presents with sudden onset unilateral chest pain, severe dyspnea, and hemodynamic instability, which is a key sign of a life-threatening condition. Now his history of COPD and smoking increases the risk of a spontaneous pneumothorax. And on examination, the absent breath sounds and hyperresonance point towards air trapped under pressure, which is a tension pneumothorax. So this patient has pneumothorax. Now pneumothorax is defined as air within the pleural space and may be primary or secondary. Primary pneumothorax occurs in patients with no underlying lung disease, and secondary pneumothorax occurs in patients with underlying lung disease such as emphysema. The treatment of pneumothorax is dependent on the size, the patient hemodynamics, and the comorbidities, with management ranging anywhere from observation to immediate needle decompression and chest tube placement depending on the severity. The options given here are A. Broad-spectrum antibiotics, B. Chest tube placement, C. CT scan of the chest, D. Immediate needle decompression, and E. Observation. The correct option here would be D. Immediate needle decompression, and that is because this patient has a tension pneumothorax and is rapidly decompensating with hypotension, tachycardia, tachypnea, and hypoxia. Immediate needle decompression is required to relieve the pressure and stabilize this patient. This should be performed promptly in the right second intercostal space before placing a chest tube for definitive management. Let's have a look at why the other options are incorrect. Option A is incorrect because broad-spectrum antibiotics, they are not the treatment of choice for tension pneumothorax. And option B is incorrect because a chest tube will eventually need to be placed, but it is not the most appropriate next step in management in this case, given the patient's hemodynamic instability. And option C is incorrect because the chest X-ray has already confirmed the diagnosis of a pneumothorax, and obtaining a CT scan would add no additional useful information and would only delay treatment. Option E is incorrect because observation would be inappropriate in this patient with tension pneumothorax. Only small and simple pneumothorax in young healthy adults may be amenable to observation. A 7-year-old girl is brought to the clinic because of fever and difficulty swallowing that began 3 days ago. She recently attended a birthday party where several children were reportedly ill, and her temperature is 38.8 degrees Celsius, her pulse is 115, her blood pressure is 105/70, and her respiratory rate is 16. On examination, she has tender anterior cervical lymphadenopathy and bilateral tonsillar swelling with whitish exudates. A rapid antigen detection test is negative, but throat culture later shows beta hemolytic colonies on blood agar, and gram stain shows gram-positive cocci in chains. Which of the following is the most appropriate treatment for this patient? Now, the symptoms of fever and difficulty eating, they are typical of pharyngitis, and tonsillar enlargement on examination with exudates, they are hallmark of streptococcal pharyngitis. In the examination, the anterior cervical lymphadenopathy is another strong clue for streptococcal pharyngitis. With regards to the tests, the rapid antigen test is negative, but the throat culture showed beta hemolytic colonies, and the gram stain showed positive cocci in chains, which is diagnostic for group A beta hemolytic streptococcus, which is Streptococcus pyogenes. Now, the options given here are A, isoniazid, B, methicillin, C, metronidazole, D, penicillin, E, streptomycin. Now, the correct option here would be D, penicillin, and that is because the laboratory cultures indicate infection by beta hemolytic streptococci, which is Streptococcus pyogenes. Now, the rapid strep test is a useful mean to quickly diagnose strep throat infections. However, the sensitivity of the assay is approximately 86%, although there are some studies reporting it as low as 70% or as high as 92%. Thus, in cases of suspected strep throat infection, a throat culture is still the most reliable method of diagnosis, and penicillin is the preferred antimicrobial for the treatment of strep throat infections. Let's have a look at why the other options are incorrect. Option A is incorrect because isoniazid is used to treat infections caused by mycobacteria, such as Mycobacterium tuberculosis and Mycobacterium leprae. It blocks synthesis of mycolic acid, which is a component of the mycobacterial cell wall. The clinical findings in our question indicate that the patient has strep throat infection, and mycolic acids are not structural components of the streptococcus cell wall. Therefore, isoniazid would be ineffective. And option B is incorrect because methicillin is reserved for the treatment and infections by strains of gram-positive bacteria such as Staphylococcus that are resistant to other beta-lactam antimicrobials. The clinical finding in our question indicate that this patient has a strep throat infection due to Streptococcus pyogenes, which is sensitive to beta-lactam antimicrobials. And option C is incorrect because metronidazole is used to treat anaerobic bacterial infections and certain parasitic infections. It is ineffective against aerobic and facultative bacteria such as Streptococcus pyogenes. And option E is incorrect because streptomycin is an aminoglycoside and is used for primarily treating infections caused by gram-negative rods. And aminoglycosides are not used to treat infections caused by streptococci or enterococci because they do not penetrate the cell wall of these bacteria.